To this, more than 100,000 adolescent girls give birth in South Africa each year. Specifically, the number of births delivered by teenagers at the country's public health facilities continues to rise at an alarming rate. This increase is a setback for the girls who are looking to secure a better future for themselves, as well as their now children. One of the many challenges being faced is how to educate young girls about the use of contraceptives, as well as the dangers of pregnancies at a young age. I'm now joined by a public health specialist at the South African Medical Research Council, Dr. Kim Jonas, who joins us from Cape Town. Thank you so much for your time this afternoon. Now, it's important when setting the tone on this topic that we address every few months to remind us that pregnancies in those under 16 should be considered rape, as the legal age of sexual consent in the country is 16. Now, it makes dealing with this scourge so much more difficult and complex in a country dealing with such a huge gender-based violence problem, isn't it?
That is correct. Thank you, Martha, and thank you for inviting me this afternoon. Well, it is indeed a very concerning issue in the country, statutory rape. As you've seen that indeed the teenage pregnancy rate continue to increase in our country. But this is not the only factor contributing to the teenage pregnancy rate. I would acknowledge that the gender-based violence among young women and children in the country is so pervasive and it needs to be addressed. But there are other factors related to limited knowledge and education about contraceptives, poor access and use of contraception services, and poor adherence to contraception method when they've been provided to the young women and girls. So the other drivers also include parental support and partner support. So whenever we try to address the issue, we need not to leave behind the parents and the communities and the partners within the interventions that we aim to roll out.
Now, when dealing with issues affecting modern-day teenagers, it's almost easy to dismiss it, saying, oh, but they've got so much more information at their fingertips compared to generations before. They just go onto TikTok or they go onto Google. They can just look everything up and it's right there. But in your research, you found that, firstly, a large number of young women don't have access to that information. They also don't have access to contraceptive for various reasons. And many of them don't believe that contraceptive is healthy for them or can help them, and that's because of misinformation. How important is that communication and access to information for our teenagers, and what seems to be the biggest stumbling block in getting that information to them?
First of all, we don't normalize access and easily access to services for young women and girls in the country. I think the problem is we put so much blame on young women and we forget that we're not doing our part ourselves to open the spaces for them to access contraception services freely and comfortable. I think the issue lies onto those in power who need to create the spaces and the platform for contraception services and to demystify the myths and miscommunication about contraception services. We know that, as you mentioned, that young women and girls in our research say they don't have enough information and they're scared to go to the health facilities. So those in power within our communities have the power to actually create the space, create the platform where information, contraception services, and other services are provided within the community spaces for young women and girls, number one. And number two, normalize the social norms against contraceptive use need to be dealt with and addressed as well. If those in power are creating this platform to have billboards about different contraceptive methods, to have campaigns to demystify all these myths and miscommunication and misinformation about contraceptives, and also involve the parents, the communities, and the schools, I think we can get somewhere with addressing the issues of teenage pregnancy. But that's not that all this is. It's not a one-size-fits-all or one solution. It's a multitude of factors that needs to be looked at a wholesome perspective.
And I suppose we need all of these sectors to work together and not in silos. You can't say the health department has got this program, the basic education department has got this program, and the clinics are doing something else, or the churches are in our communities or are doing something else. Let's talk a little bit about what kids are being taught in school, in your experience and from what you're hearing at grassroots level. I mean, this is the place where kids are generally a captive audience if they're still in school, and in teenage years, one hopes that they still are. Are those spaces being used effectively to do the important sexual health education that we need?
Not to our findings. Most of the women and girls on our research say they don't have enough information, as I've mentioned. and they are not having the free spaces to access this information and services, because at the health facilities, they're afraid of the nurses. We know this, and we've been talking about this for a while. But at the schools, the current information that they provide is just bare minimum. If they're still concerned and worries about and actually believe what the community is saying out there about the myths and misconception about contraceptives, that some they don't work or some they make you fat, it shows that they don't have their proper information. And if the health services could provide these services, and when the young woman and girl is within the premises, they take leverage of that and provide comprehensive contraception counseling and education, and allow the young woman with, and provide the young woman with all the choices that they have for the different contraceptive methods, so that the young woman can make their own decision, an informed decision to choose a contraceptive method that best suits their needs. And if the young women have this accessible and provision of contraception information and services, they're likely to adhere to the prescribed contraceptive method provided to them. And it needs to be provided in a youth-friendly and responsive manner, as well as patient-centered. So each individual young woman and girl has their own needs and worries about contraceptives. So it needs to be person-centered and dealt with as that centered, responsive approach.
And I suppose also when you're dealing with young women in such an important stage in their lives, they need to be brought on board that this is something that they can take hold of, the empowerment of themselves, that their body is their own and it's their decision to decide how to protect it. I'm so glad that you mentioned about how important it is who the person is who brings across this sexual health education, because that indeed is important. You can't just have some stranger come in. You need a position of trust to be developed so that young people can be brought on board. How important is that in the communities? Because you're saying that there is a lot of misinformation. Where are they getting that misinformation from? Is it from their peers? Is it from inside communities or families or their religious leaders? And in your experience, where should we be looking to make inroads to try and stop those various nodes of misinformation?
Okay. So the first thing I think we need to unpack and understand is we need interventions in our communities and schools to address the sexual violence against women and children, amongst other things. We need interventions to raise awareness on adolescent sexual and reproductive health and rights, as well as awareness about the contraceptive methods to improve their knowledge and understanding about the different contraceptive methods. Not only go by what they hear from their peers, what they hear from the communities, because communities shape our social norms. And if many women in the communities and the social structures and cultural practices believe that or portray the message that young women and girls should not use contraceptives, or it's not safe for young women and girls to use contraceptives, we need to deal with that, because that is not the message that will encourage a young woman to use contraceptives. And for the people in power within these communities, they need to create these spaces where in the community halls, in the churches, in the schools, in all the social gatherings, they have the information, they provide the information to demystify these myths and miscommunication, so that we can improve the knowledge of young women and girls and enhance their adherence to contraceptive methods that have been provided to them.
Okay,
Another thing that we can do within the communities, the health facilities should consider really providing contraceptives in other spaces beyond the clinics, because we have experience. We know already now that many young women are scared to go to the clinics. There is this barrier that needs to be unpacked, and the clinics are always almost full. They don't accommodate the learners who go to school in terms of school time. So going beyond the traditional clinic, we'll meet the young women and girls halfway and go to the private retail pharmacies, negotiate a space to provide the free contraceptives there, where young women and girls will feel free and comfortable to ask the questions they have, to share their fears about contraception, and also to be helped and guided towards a contraceptive method that is suited for that young woman and girls. But other than that, we also need to consider an element of incentivizing the young women and girls. It's not enough for us to say, go use the contraceptives. And also the issue of always blaming them to say they have the information. I don't think we all used and knew the information when we were growing up. We were going to high school, we knew about contraception and family planning, but we didn't know exactly what would work for us individually, what would work for me, or am I also going to get the same side effects? We don't know this. So the information needs to be individualized and person-centered so the young woman can make appropriate choices to choose the contraception that suits their needs.
Okay, we're going to have
And
to leave it
also,
there. I'm
I
so
was
sorry
heading
we've run
towards
out
the
of time, Dr. Jonas. But thank you so much. So many insights there to take on board. We really do appreciate your time. That's Public Health Specialist at the South African Medical Research Council, Dr. Kim Jonas, joining us virtually there from Cape Town.